Hi there, you're welcome to RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a gift to you for subscribing to our channel, you can check out the link down below, which will get you to the free meal recipe that we have here on RX Care. All right, thank you for watching and stay blessed. Hi there. So what is our medication of choice today? So our medication of choice today is going to be known as Remicade, which is also a generic name known as Infliximab. So this medication can be used for a variety of conditions, which I'm going to tell you in just a minute. Alrighty, so what are these conditions that this medication is used for? So it's used for a condition called Ankylosing spondylitis, which is kind of like a fusion of bones in the spine area. And this is medication is usually taken in those patients as a weight-based medication. So usually patient will start with a 5 milligram per kilogram, and this is usually taken like every 2 weeks until you get to the 6 weeks, then it's every 6 weeks after that, depending on what the doctor is treating. Also, this medication can be used for treating Crohn's disease. It can also be used for treating plaque psoriasis, psoriatic arthritis, rheumatoid arthritis, ulcerative colitis, as well as sarcoidosis, and another condition called Takayasu. Yes, I know at this point you're probably overwhelmed that why am I having to take this medication that works for, all these different stuff. Most of this medication is known as a monoclonal antibody, and this is usually used for patients who have an autoimmune disease kind of a reaction that's going on. And this medication can help in terms of reducing symptoms of that condition. All right, so how does this medication come? So this medication comes in 100 milligram powder for solution. And in terms of the solution, it's usually mixed and it's given over 2 hours. So usually patients will have to stay in place for this injection to be given over a 2-hour time period. So what are some of the side effects of this medication? So some side effects of this medication include headache. This medication can cause belly pain or an upset stomach, or it can cause patients to have vomiting. Also, this medication can cause tiredness or fatigue. This medication can cause flushing. It can also cause rash, fatigue, as I said earlier, or infusion related side effects. So patients may get like a redness, irritation, or rash where the shot is given. All right, so what are some serious side effects that you definitely want to reach out to your doctor if you start noticing those side effects? So the serious side effects include any drastic form of weight loss, if you start noticing any skin lump, if you start noticing any night sweats, as well as any abnormal fever, burning, or tingling sensation in your body. Also, if you start noticing any weakness in some parts of your body, as well as any swollen gland, which may be like your lymph node. And the lymph node usually is located like around your neck area. It can also be located under your arm or in the groin area. So if you notice any swollen gland or lymph nodes in this area that I mentioned, make sure that you're reaching out to your prescriber and letting them know. That way they can evaluate the medication and make sure that this is the right choice of medication for you. All right, so what are some other things that you need to know about this medication? So this medication, as I said, is given over a 2-hour period. So usually patients will get it injected into their vein. And like I said, patient has to remain in place for about 2 hours. That way we can infuse this medication properly in those patients. Also, in terms of this medication, because it is a class of drug known as monoclonal antibody, it is required or recommended that you avoid live vaccines while you're on this medication. And what this helps with is it kind of reduces that risk for infection, because most often patients who are on this medication, their immune system may be a little suppressed than the average healthy adult. So making sure that you're avoiding that live vaccine will kind of reduce risk for infection and also reduce any symptoms that may occur due to you taking that injection around the time where your immune system isn't all that great. All right. Also, if this solution changes color or if it becomes cloudy, make sure that you're reaching out to your prescriber or your provider. That way they can check out and make sure that this medication is not altered. All right. And also in terms of injecting this medication, it's usually you want to make sure that you're injecting this area in a non-irritated skin area in order to avoid any redness or any further irritation in that part of your skin. Also, in terms of this medication, it can increase risk for certain cancers such as lymphoma or leukemia. So if you start noticing any side effect that seems abnormal, make sure that you're reaching out to your doctor. That way they can evaluate and make sure that this is not as a result of the medication. Also, when patients are about to start this medication, usually they will do an hepatitis B test as well as a tuberculosis test to make sure that patients do not have any of this disease or condition, and in order to reduce any risk for mortality in patients who may have this condition or disease and are also taking this monoclonal antibody that can kind of suppress the immune system as well. Also, like I said, this medication, because of the side effect or the way the medication is administered, patients are usually given this medication along with allergy related or allergy reducing medications such as your steroid, which would be like a dexamethasone or prednisone. Or patients may receive this medication along with Benadryl, as well as a medication known as fever reducing medication, which will be your Tylenol. So patients usually may get this before or during their infusion, depending on how well their body is tolerating this medication. Also, in terms of taking this medication, you want to make sure that if you are a female, you want to make sure that you're reaching out to your doctor if you notice that you may be pregnant while you're on this medication. That way, the doctor can let you know the next line of treatment if this medication would not be suitable for you. All right, I hope you were able to learn one thing or two about how to take this medication, what the medication is for, and other pertinent information regarding this medication. Like I said, make sure you hit the like and subscribe button down below. That way you can support our community here at DemiRx Care. And also, if you have any further information or questions or concerns regarding this medication and you would like to talk to a pharmacist or a medication expert about it, make sure you reach out to us at www.demyrxcare.com, and there you'll be able to have a one-on-one consultation with a pharmacist that can walk you through other information that you need to know about this medication. All right, thank you for checking us out today. Stay blessed.